morning, everyone. I'm so grateful to be here today as the founder and CEO of Volunteering for Seniors organization, where our mission is to keep seniors active, engaged, and connected to their communities. It's truly inspiring to bring valuable resources and knowledge to our senior community, and today is no exception. Arthritis is a condition that affects millions of elders worldwide, often limiting their mobility, independence, and overall quality of life. Whether it's osteoarthritis, rheumatoid arthritis, or other forms, the pain and the discomfort associated with arthritis can be challenging to manage. So today's topic, discover natural relief for arthritis in seniors, is especially important because it focuses on holistic and natural approaches to managing this condition. Natural relief options not only complement traditional treatments, but also empower seniors to take charge of their well-being through accessible, gentle, and often side effect-free methods. We'll explore today how lifestyle changes, dietary adjustments, mindfulness techniques, and holistic practices like homeopathy can play an important or very significant role in elevating arthritis symptoms. These approaches can improve flexibility, reduce pain, and most importantly, help seniors, pre-seniors, everyone enjoy a better quality of life. So we are truly honored today to have a very special guest with us to guide us through this discussion. Joining us here today is Vandana Pitke, a certified homeopath with over 20 years of experience in the field. Vandana is not only certified by Council of Homeopathy in US, but also serves as the president of the Rhode Island Holistic Healing Association. Her journey in homeopathy began with a BHMS degree and I think from Pune University, one of the world's prestigious institutions. She further enhanced her expertise by earning a master's in psychological counseling from IBMS, India. Vandana's reputation as a very much, I can say, compassionate and highly skilled practitioner is well deserved. She blends her profound knowledge of Eastern and Vedic philosophy with various holistic healing modalities to design personalized treatment plans and truly resonate with her clients' needs. She's also an educator, and she frequently teaches homeopathy and other holistic practices and contributes to holistic health publications. So today, Vandana will be sharing her insights and her expertise, particularly in the area of homeopathy and arthritis, a topic that affects so many in our community. So please join me first in giving a warm welcome to Vandana Pitke. Hi, Vandana.
Hello. Hi, everyone. Thank you, Pratima, for having me here today. It's a pleasure and honor to be here on this platform. Yeah. And thank you, everyone who joined today.
Thank you, Vandana. So just to begin with, I would like to start first with the general understanding of homeopathy for arthritis and then ask, questions as we go through this conversation.
Sure. Yeah. So homeopathy, the word itself explains so many things. It's a combination of two words, homeos and pathos. So homeos means similar and pathos means disease. So back in like 1700s, like 80s, 90s, Dr. Samuel Hahnemann in Germany was a physician, and he like discovered like he was translating the medical journal, and he found a reference that if a substance is ingested, eventually a healthy person gets symptoms. So he started using cinchona bark juice, experimenting on himself, and he started drinking that juice, and he got some symptoms like malaria. So eventually he started using that juice on the patients of malaria, and they got cured. So this is how homeopathy was born. So a substance which is responsible of creating symptoms in a healthy human being can be used in a potentized form to cure similar kind of symptoms or conditions. So homeos means like, cures like. The base is like similia similibus curanter, or in simple words, like cures like.
So that's a basic understanding. And then
Yes.
as you go further, Vandana, like which remedies are, I mean, of course, the topic is all about arthritis, but to begin with, like which homeopathic remedies are most commonly recommended for managing arthritis pain, and why are those medicines recommended?
So the very first thought comes to what kind of pain. So homeopathy is an individualized medicine. So even if say I'm treating two people of arthritis, but if the pain is somebody might have say burning pain, somebody might have say sore, or somebody might have say stiffness. So it's all depend upon what kind of pain they are experiencing, how severe the disease is, and what are the modalities. So somebody, mostly arthritis is like aggravated during winter time or cold season or cold temperatures, right? But there are some people who might feel with cold applications better. All right.
Okay.
So the remedies can be different. So very commonly we use Rustox, the medicine which we make from the poison ivy. Then the second one is Bryonia, rhododendron, colchicum, then sometimes arnica. Like most of the time, arnica is considered as a injury medicine, but you can still use in the form of for arthritis as well. And there are a couple of other remedies, but these are the common ones we can use.
I see. And how does homeopathy especially target the joint inflammation and stiffness? Because I know that that's what a lot of people even ask for that. And how do they basically target them in arthritis patient?
Okay, so the whole concept of homeopathy is based on individualization and holistic approach. So that means we consider most of the lifestyle, then again the age of the patient, then how severe or how chronic the disease is, how long they have been suffering. Plus, it comes to homeopathy is the last resort. Mostly people go to. They are already on the pain medication. So mostly we go into the integrative approach, and then we cut down slowly all the allopathic medications, tapering the doses. Um, how homeopathy works specifically in reducing the inflammation or in case of arthritis. So each dose is a boost to your own healing energy. All living beings have the healing energy within themselves, but like we are not aware of it, or we are not in daily lives we have forgotten that hey, we have that energy within us. So all all the doses is just a boost to your own healing energy when the remedy matches to the symptom of the patient. And slowly our own healing energy, the life force, takes care of that inflammation. um, if you see the pharmacodynamics of all these remedies, if you use them in lower potencies, because they are herbal, they are natural remedies in mother tincture form. So we can say yes, there are remedies. So Roostox is a specific remedy for stiffness once you wake up in the morning, right? And all the plants and all the natural remedies, they have them those alkaloids, those enzymes to work on that specific inflammatory factors. So but when we put it into the dynamic form or potentized form, those remedies act on the life force or the vital energy which we all have. So it's what potency we are using. So most of the time, if it is really very chronic disease, like too old patient is there, we will go with maybe lower potencies in homeopathy. Okay. And when I say potency, that means if you on the bottle, if you have seen, the name is written and then the number is written, right? So that number is a potency of that particular remedy. So for older patients, we use up to 6C or 12C potency, and mostly or maximum, say 30C potency. That means that remedy is diluted those many times of whatever the number is.
Oh,
Okay.
got
Mhm.
it. And coming to the, as I was talking about, efficacy part of it, right? So how quickly can elders expect to see any improvement, right, if they have arthritis symptoms using definitely homeopathic treatments?
So if the disease is not a progress so much chronic, I would say, if it is just a start of it, within 1 or 2 weeks, you should be able to see some results. If it is really very, very chronic, from years and years, people are taking anti-inflammatory, then pain medicines, and if specifically RA, the rheumatoid arthritis. So it takes several days to several weeks to see really the result. So I have currently couple of like patients who are having rheumatoid arthritis. One is in late 50s, one is in 70s. So and it all also like how good your life force is, how good vital force is, how resilient you are. So if somebody is really like maintaining good lifestyle, having a really good general health, they might feel the results very quickly. And sometimes it might take several weeks to several months as well. It all depends because it's an individualized medicine.
Got it. Also, Vandana, I know that some of the seniors who I was talking to, they had a question like, are there any potential side effects because they were only using allopathy till now, right?
Right, right.
Any potential side effects or risks that is associated with using homeopathic remedies, particularly, I'm saying only with particularly when it comes to elders because they have been taking allopathy for a long time.
Yeah. So there are no side effects as such because the homeopathic medicines are really very gentle and diluted and potentized several times, right? So they don't remain any toxic and there are no side effects. Since like I started my practice, I haven't seen any side effects so far.
Mm.
All the cases, there are no side effects. The only effects I have seen, they sleep well, their energy level is good, their stamina is good, they feel happy, and most of the times we cut down all the allopathic medicines as well while like tapering the doses. So homeopathy when integrated along with the say herbal or allopathic medicines,
Right.
eventually we can cut down all those like the medicines along with homeopathy. So
They
no
can
side.
definitely take it with combined with other
Yes,
therapies.
yes, yes, yes. There is
Um,
no interactions as such because I treat so many cancer patients, those having chemotherapy as well. We can go with integrated approach with that.
yeah. That's
Mm.
interesting. And how do you basically customize the homeopathic treatments, right? For elders or who are 50 above, based on their severity, depending on the severity of the arthritis, how do you customize that?
So when I say individualized medicine, I go through the whole case taking like first session, and where I come up with a treatment plan. So my treatment plan combines not just the homeopathy, but I incorporate many other holistic modalities. For example, mudras, simple like hand gestures to, or sometimes the cell salts I use. So it's all the combination of what that patient is looking for, what they are suffering from, because sometimes it's not just the arthritis, they might be having some side effects of say pain medicines, say acidity is there, or say liver damage is there, or say kidney damage is there. So I have to like look for all the like details because I am treating the whole individual and not a particular say joint pain or arthritis or any health condition. So the whole first session gives me an idea what I need to combine in the treatment plan.
So when you talk about lifestyle changes, right? So what lifestyle changes or you can say or complementary treatments do you recommend along aside with the homeopathic remedies?
Yeah, so lifestyle means like, just keep yourself moving, keep yourself active, and follow the routines, like the very basic, like because my family background is Ayurveda, my brother is Ayurvedic doctor, and many other people in my family are like following the Ayurveda regimen. So, yes, follow the routines. Mostly like have your meals on the regular time every day, go to bed every day, same time, wake up every day, same time. That the routine, um, like follow the seasonal cycle as well. So whatever like we have been following, right, particular foods we eat in during those season or those festivals, so that also makes the whole difference. So this is the winter season and we make the sesame jaggery laddus or the gajak, right? So our ancestors made something very useful for us which we need to remind ourselves often and follow the seasonal routines as well. Or during Diwali time we go for abhyanga, right, the whole body oil massage,
Yeah.
because that really keeps the joints moving, and not the air element go high in the joint pains or arthritis. So keep those minds, like whatever we have been following during the festivals time, just follow that.
But coming to this same point, Vandana, because not many patients who might approach or ask questions who might be from the Indian, basically from our backgrounds, right? If they're from different cultures, how
So
are you able to explain them the lifestyle changes with respect to not just doing exercises or
yeah.
just walking? Is there anything else that you can recommend?
So whatever exercise you can do, yoga is the best, walking is best because we cannot go like, do the HIIT programs or like very the gym and all. Whatever you can like do, whatever is comfortable for you, that is fine. Do that, but keep yourself active and not just like sedentary lifestyle. And even if like I'm not just talking about the Indian say asset, but if you see most of the seasons in the winter time we eat lots of sweets. So when I'm saying sweets, it's not like the sugar I'm saying, naturally sweetening agents, right? Natural sweeteners. So even the pumpkin, seasonal means whatever vegetables fruits we get into that season,
Mm.
choose those, go with those traditional recipes. Or we eat most of soups during winter time to keep ourselves warm.
Right.
Yeah.
So should they take it? Because remember in Ayurveda, I don't know whether there's something in Ayurveda where you don't have to take yogurt, but in
Buttermilk.
homeopathy, yeah. So in homeopathy medicine, I just wanted to know about that diet. If some people would prefer to constantly have their food, how is the dieting should go? Like if they're eating the general vegetables and fruits along with the medication, there is no constraint like Ayurveda has, like certain things you should eat and certain things you should not eat, right? So is there anything that in homeopathy, or it is general, like you can have whatever you want, but continue taking these medications?
Yeah, so as long as if I'm talking about homeopathy, there are no as such dietary restrictions. It is me who describe like all the regimen in the diet to all my patients who are really interested to change their lifestyle, because I have seen most of the time people just cook for 1 week and they just microwave the meals every day and they will eat it. So this is a like big no-no if you are seeing me, because there is no life energy, you are reheating and killing all the life energy whatever is like remained in that food. So don't do that. That is the number one cause of arthritis, I would say.
Got it.
So
So
because yeah, leftover frozen foods reheating again and again is not best for arthritic management. Another is the raw vegetables, because nowadays there is like a fad going on, like people, the first meal they will eat the smoothies. Don't do that. Raw vegetables, if you are having arthritis, cook them, steam them, saute them, and then you can make the smoothies. But eat them like chew the vegetables, because the digestion starts itself in the mouth. Smoothies, you are just dumping your system with all those like vegetables, and like it takes a lot of time to digest that.
I agree. And
Mhm.
also, is useful, I mean, possible to use these remedies of homeopathy to delay or even reduce the need for joint. Like some people don't have, but just to make
Yes.
sure that you take some remedy, but that's going to, I would say, delay the need for any joint replacement if they're thinking about any surgeries in future.
So there are no remedies in homeopathy when we can say preventative, because homeopathy is therapeutic. If you really want to delay or like keep yourself healthy, the changes in your lifestyle and like to start early, like in 20s 30s, follow the routines, do the exercise and delay the process. Cell salts, yes, cell salts is another modality I use. You can take it as a preventative. Cell salts is nothing but a potentized form of minerals which we found in the like in the nature. So every cell has some kind of minerals. So if you take those, we can take, prolong the pace, or we can kind of prevent those inflammation or um, other disease conditions.
Okay.
Mhm.
Is there anything else you want to explain in detail, Vandana, about this arthritis? And in general, how do you want to talk about the use of homeopathy in arthritis?
So as I said, like there are a couple of remedies, and it we go with individualizing those. So I already mentioned couple of them. if people are interested, I can send them the handouts, what remedies they can use and what kind of pain and what modalities we need to consider. For example, Ledampal is a remedy when the patients feel better with cold applications, and Roostox is aggravated by cold applications. So just keep those things in mind, and then I can, they can use the handouts I'm going to send you.
Definitely. We definitely would love to have those resources so that if
Uh-huh.
anybody wants to go through that, they can see.
Yeah,
Um, I have one question.
sure.
Is that how do you address the common skepticism that surrounds the effectiveness of homeopathic treatments, right? Basically for chronic conditions like arthritis, a lot of skepticism that goes, say like, if you have heard also about that.
Yes, yes. Yeah. So the first misconception, I would say homeopathy is very slow, right? So it's not like that. Most of the time homeopathy is the last resort what I have seen in my practice, or even like when I was a student, that time also like people come like they allopathic, then Ayurvedic, then herbal, natural medicine, and then they come to homeopathy. Um, the more you're suffering with that condition, so chronic, so severe, the results will be delayed. Because I most of the time when I see like people with fevers, coughs, diarrhea, the results are within 1 or 2 doses, we can see the improvement.
Mm-hmm.
So homeopathy is not slow. Yeah. Even I had a case of diarrhea with bloody streaks in the stools, and that was like cured just within 1 dose. So it's not like it's slow. Another is there are many dietary restrictions when it comes to homeopathy. Olden days they used to cut down like onion, garlic, and maybe coffee, but nowadays there are been research going on. Even I took like my doses and then the coffee and nothing happened. There is no antidoting effect on those remedies in homeopathy. So no dietary restrictions as such are there. At least I don't ask anyone to follow anything. And the what else? Another is it takes too long time, or you have to keep taking the homeopathic treatment for years and years. It's not like that. Once you see the improvement, you can cut down or tapering the doses and then see how you're doing, and then reintroduce if the condition comes back or if the pain is there. um, and yes, there are limitations, there are scopes. So if there is a case where the surgery is needed, you have to go for it. We cannot say, hey, just take homeopathy or just keep taking the painkillers. And because if the quality of life is going to be improved after the surgery, why not go for it?
And coming to the treatments part, I mean, of course, here we have to use the insurances. So all the insurances go with the homeopathy. How does that work?
No, homeopathy is not considered they don't cover it under the insurance. Certain conditions they might be, but as a practitioner, I don't take care of all these insurance, and all the clients or the patient will reach out to the insurance. But most of the time, no. But if you have HSA card, the consultations you can pay through the HSA card, and Amazon also has some remedies available by purchasing under the HSA.
Yeah, I have this question because there are elders who they just prefer to go through the insurances, right? So this
Mhm.
has to be not through insurances, but as you said, only if they have HSA card, and if they don't have, it is out of their pockets, right? They need to pay.
Yes, yes, yeah.
Got it. Before I go further or have any, I want to check with the all the participants who are here today. I want to check with Rama. Is there anyone else, Rama, who wants to ask any questions to Vandana?
No, I don't see any questions. But again, request all the participants if they have any questions, please post on the chat, or you
Definitely
can
ask.
unmute and ask your question.
Yeah. Also, apart from that, Vandana, do you have anything that would be, which definitely this topic is about arthritis, is something which I didn't ask, and with respect to questions that you want to a little bit more focus on?
Uh, like in general, I would say when if you decide to go with homeopathy or any other natural medicines for treating any other conditions, not just the arthritis. So educate yourself first. Like try to understand the talk. Like this is an interactive session, so know more about that modality and choose what do you really want to achieve. So in my first session, when I take a whole case, I
Yeah.
just ask the people, like, what are your goals? What do you want to achieve? So educate yourself so that you know what you are expecting in that session, and you, then you can, like, set your goals, and I work accordingly. Because sometimes we just choose one condition, what is bothering them the most. They might
Yeah.
be suffering with other health issues as well. So specifying your goals is the most important thing, first thing, and then educate yourself, and know more about the modalities you will be willing to go with. And as I said, like, I combine many other modalities in my practice. So if if there is no, say, pain as such, or you just want to like maintain your health, mudras, cell salts, and gemotherapy are the best one to start with. So mudras is nothing but you are holding your hands in specific
Correct.
positions, right? So when you are doing your meditation, just hold your hands in prana mudra. So little finger and ring finger joining to the thumb. This is the prana mudra. So this is the
Mhm.
universal mudra that keeps you, like, healthy. And the name itself suggests the prana mudra. So the life energy goes where it should be.
Correct.
Yeah. So something like, learn something and incorporate in your lifestyle, says, or oil massage. Start oil massage during the fall season itself, November, December, like
Mhm.
January, February. These are the best seasons to have the whole body oil massage. And that can keep all the, like, it's there are several therapeutic effects of the oil massage. You can just come, like, add some garlic or some carom seeds, or even some essential oils are best to put into the and you can use any oil, say almond oil or sesame oil. You just heat it and massage the whole body with that. So these are the two things I would say as a preventative, as a lifestyle change, to incorporate from early age uh, to keep yourself healthy.
So I have a question, Vandana.
Sure.
Because I did take homeopathy too, and I noticed that is it like is only for 3 days or 4 days you continue taking those, I did take arnica too. So when you take medicines like that, do you only continue for 3 days? Because I know it shows improvement. As soon as it shows improvement, I stopped it. I mean, that's how
Mhm.
we do it, right? Or is there a tenure, like you have to continue it for a week or so?
So it all depends how severe the pain is, how severe, like, chronic the disease is. If it is really like from years and years, somebody is, say, like, suffering, the treatment plan goes like up to certain weeks or certain month, like, say 3 months to 6 months as well. The more the pain is, the frequent the doses are, and the long the duration is.
Yeah.
Once you see the improvement, so somebody, like, you might be taking for, say, acute pains. It's not like something you're looking for, say, a chronic one. That's why in 3 days you see the results and you cut down the doses. But if somebody is, like, typically rheumatic arthritis, right, rheumatoid arthritis, if we have
Yes.
to go for longer time. Osteoarthritis, it's a chronic disease. So uh, take the doses as needed, and then keep the doses as maintaining doses as well. So, and it all goes, it's individualized approach. Case to case is different.
Absolutely.
Mhm.
Hi, can I ask a question? This is Deepa here. Hi, Dr. Vandana.
Hello, Deepa.
Hi. I am 46 and I have started with, after I delivered my child in 43, I started with finger arthritis at a very early age where
Mm-hmm.
my, fingers started getting crooked. So I am under medication, like a homeopathy medication. But I have a
Mm-hmm.
question, like being living in these colder places, how does
Mm-hmm.
cold impact on it? And 24 hours in the Indian houses, we are doing something, cooking and putting hands in the water all the time. How does it impact your body, and what is a solution to it? Or do we need to wear some bands on our fingers or anything of that sort? Will that help for that?
So yeah, it depends, right? So you said, like, in colder area, what city you are in?
I'm in Boston.
Okay. Yeah, so definitely. So I would suggest, like, along with homeopathy, the oil massage is the best, like, because that keeps your body warm.
Okay.
Drink some herbal teas which are like really warming, say ginger
Mm-hmm.
lemon tea, or say even the essential oils can help. You can just put the edible essential oils into your teas or something like that.
Okay.
Um,
Okay.
yeah, and keep yourself warm and start early. Like if you already have arthritis, you
Mhm.
can, start the oil massage early, say in
Okay.
October, November, and
Okay.
keep yourself warm.
Okay.
Um, Drink the boiled water
Okay.
most of the time. It's not like, cold water. Don't go with the room temperature water.
Okay.
And again, I don't know other details, but I like
Sure.
if you're taking homeopathic medicines,
Mhm.
just I would say as needed, increase the doses.
Okay. Okay. As per the weather, like literally, this is the first month where I have started. And
Uh-huh.
luckily, my friend just passed me this on, and she said we have something in Boston, very close to Boston, in Boston too. So
Yeah.
this was very interesting. So I wanted to join and understand how does this entire process work and how it
Uh-huh.
should be. Yeah.
Yeah.
Thank
And
you.
yeah,
Sure.
it's like homeopathy medicine will help reduce the inflammation, no doubt. But if you are
Yes.
managing, say steam or heat, or like keep your hands, even that little pouch, like we shake it and it warms, the hand warmers, that can also help.
Yes. Yes.
Yeah,
Okay. Awesome. Yeah. Okay. Thank you so much.
So
yeah,
there are two more questions that came in.
yeah.
One from Meghali. Does homeopathy cures arthritis completely or just to helps to manage the symptoms, especially at our older age?
So what we are treating, is it osteoarthritis, rheumatoid arthritis, or gout, or what it is? It all depends. What's the age of the patient, how chronic the condition is, how long they have been taking other medications. It all depends. Like most of the time, it is managing the disease, and if it is not too like chronic, like not on many medications, then we might say yes, there are chances of curing as well. But if it is osteoarthritis, we need to manage the disease.
Before
But
we go on another question, we have got another question, Vandana. There's one senior, that's why I was emailing him.
uh-huh.
He was asking about the pain and mobility part of it. Okay. So he wants to know that can you describe the pain or the discomfort? Like, is it which activities, because he has a lot of pain issues, right? So for him, and I think I just want to know too in general, which activities or movements are most difficult for most of the people who have arthritis, right? That's one is the mobility, right? And they may
Mhm.
also have the stiffness in their joints and everything. So with this type of treatments, what treatments and therapies are easy for them? I think you did answer that, but he wants to
Yeah,
ask on that part again.
yeah. So as I said, the remedies in homeopathy, they act on the vital force. So there are a couple of remedies we like start with, either one or two, or sometimes a combination. They can help to reduce the inflammation, and once you see the improvements, we can other modalities can also be introduced along with homeopathy. If there is like too much stiffness, like somebody is not able to move their hands to, or one of the patient 2 days back I saw, they were not able to even feed themselves.
Right.
So yeah, in this like I would say, like if you are taking already the pain medication, just introduce homeopathy, see how it is helping, and then we can come up with like tapering doses or something, uh, like additionally we can incorporate with that. So there was a girl, of course she was young, so the vital force and everything is like, but she was on the pain medication. She was having scoliosis, and the highest dose of painkiller was also not helping. So after introducing homeopathy, slowly in 3 to 4 months we cut down all the medications and she saw the improvement. It all depends on, like who is suffering, how long they have been suffering, and what medications they already are on.
And this is a question which, because you already answered this, but this is somebody who just texted me that can you take homeopathy medication alongside the RA medications?
Yes,
I think they can, right? So, yeah,
yes,
I mean, I know that you covered that, but that was again a question. And there was another question about insurance, which I asked. So I
hmm,
answered them because for
yes,
that, it's very unlikely, right?
yeah,
So
yeah.
they have to go with the with their pocket thing.
Any
And
medication, yeah, corticosteroids, RA medicines, then even chemotherapy, yeah, whatever treatment they have been taking, we can incorporate homeopathy with that.
And I'm not sure if this is already answered. What are some anti-inflammatory Indian foods to eat and which are inflammatory to avoid?
So I follow Ayurvedic concepts when it comes to diet. All right. So it all goes like, again, it's an individualist medicine. So there is no particular like formula or say protocol as such. Whatever prakriti, whatever like symptoms you are, what region you are living in, I suggest the diet and the lifestyle changes accordingly. So most of the time we say sugar, it's not good. But if you are a pitta person, go
Mm.
for the raw sugar, cane sugar, right? Or something sweet, dates, or something like, which can pacify that pitta. All right. So it's again individualized approach.
So it varies from person to person. Yeah.
Mm-hmm.
If is there any other question anybody wants to ask? Because some of the questions are very repetitive. That's why I'm
Right.
writing what I had already mentioned, that it has been already mentioned in the recording part of it. And I think there was one question which I'm pretty sure you also, again, in a different way you answered, is that for rheumatoid arthritis, what is the best remedy? You know, I think the one which you told is definitely anti-inflammatory supplements, right? Or they take the anti-inflammatory supplements along with that, they can take with respect to rheumatoid arthritis, whatever is given by the homeopathy diets, right?
Yeah. So let me share one case with you. So she was taking the RA medicines like last year. I started seeing her like 8 or 9 months ago, and she was on the steroids that time. And we cut down all the steroids, and we are managing all the pains and everything now with homeopathy.
Mhm.
So the approach is like, if the pain is really severe, we go with integrative approach. If like, once we see the improvement after introducing homeopathy, we cut down the doses of the allopathic medicines. And sometimes like people are like very very clear that they don't want to go any allopathic route. So I have one lady, she's in like her mid 70s, she never goes to allopathic doctor, and we manage all the like case homeopathically.
Okay.
Yeah.
So when you say RA, it's like basically what, like the curcumin, fish oil, those are the things they take mostly.
The RA medicines are like, anti rheumatoid arthritis, all those allopathic medicines. There is a whole protocol of methotrexate and all those medicines, right? So sometimes that the pain is so severe, they are not able to like even touch the ground or move the hands. There is so much swelling, so much pain.
Yeah.
So the allopathic doctor put them on the, and it's a autoimmune disease. So it's very complex, very complicated disease to manage.
And then why is that, Vandana? Some of the people, they actually mention that because of the still study going on, or it's poorly studied when it comes to rheumatoid arthritis, homeopathy study has to still improve in that. I mean, I don't know, is it true, or do have for reducing the symptoms?
As long as I have seen in my practice, yes, the symptoms like there is a like a cycle. Like sometimes it's aggravated, sometimes it's like no pain is there, and most of the time the seasonal changes make the whole difference, right? The rainy season, the cold season, it makes a whole difference when it comes to stiffness and pain. So we have to manage that case accordingly. And as long as the research part comes in, there are several studies being going on. Like, and again, what protocol do you use for the like it comes to research, right? As I said, it's individualized remedy. But if you are picking a one remedy for rheumatoid arthritis, not
Mm.
necessarily that remedy is going to be helpful for each and every patient involved in that research, or even like other like settings, not the like actual patients, but say um, there are several steps in clinical research as well. So it's not like allopathically how do we research. uh, it's not all the protocols are not applied to homeopathy because it's individualized medicine.
Agree. Yeah. Yeah, and thank you very much. Is there any more questions? Is there someone we did not answer, Rama?
I don't see anything. All good.
I think it should be good. So I think I would like to definitely, after definitely listening to what Vandana Pitke was explaining, is today's session on this. Remember that I think everyone who's listening, that correct me if I'm wrong, Vandana, is that managing arthritis is about definitely finding the right balance of the treatments that work for you.
Yep.
And homeopathy offers definitely holistic approach that can complement other care strategies. But it's important to always consult a qualified practitioners to
Right.
tailor a plan, whatever is, depending on your unique needs, depending on that.
Mm-hmm.
And I think, again, as Vandana Pitke was again explaining here, is that she wants to encourage all of people who are listening is to take definitely proactive steps in managing one's arthritis, whether it is through homeopathy, lifestyle changes, or other therapies. Also, I would like to first thank you, Vandana, again, for joining today and giving us so much information on, and sharing your expertise today and this insights. They have certainly will make, and I'm very confident to have a positive impact. We'll have more questions coming in, and I'll share that with you down the lane. We did also like to thank all of us today who took time to join and ask some of the questions to Vanna. Your health is wealth, and we hope that you all empowered are to take action after today's discussion. Before we wrap up today's session, I did like to mention that we'll have more such virtual talks. And if you want any particular subject or topic, which again, with respect to homeopathy, that you want us to have a discussion with Vandana Pitke and get more information, please let us know. And you can also email us directly to our organization email, which is info@volunteeringforseniors.org. So again, thank you everyone who's been here. Stay safe and stay healthy, and hope to see you all again.
Yeah. Thank you. Pratima, is it okay if I share quickly one case or?
Absolutely. Please go
Okay,
ahead.
so sometimes like people who are coming from India, seniors, they ran out of that medicines, right? So one lady approached me. She was already taking a combination of homeopathic medicines. So I go with individualized approach and classical homeopathy. So that means one remedy at a time or the complementary remedies. So we don't go with the combination medicines which we get into the market. So, and I asked her, why are you taking this? So she said, like the homeopath in India, they gave this medicine to me. It was obviously not available in US, so I gave her some alternative, and I said, like, why don't you go for an individualized approach? Um, and when I took her whole history, her whole arthritis, like that was stemming from the root cause was anger. So it was such a a deep case. The arthritis she was suffering from 9 years, and it was like the anger was coming from towards all her family members.
Oh,
They had some dispute in the family from the property, and somebody killed her 9-year-old son in front of her. And that anger, so she said the words were like uh, why to cry, because I my all my tears are being dried up, and all her anger was shown into the form of arthritis. So in this regard we cannot go with the combination medicine. All right, so what we do is an a constitutional remedy which can take care of that anger.
mm,
So
it's really
slowly, yeah. So it's when I say the individualized, so we never know. Like definitely, when it comes to arthritis in seniors, it mostly related to wear and tear in the joints because of the age. But when it comes to say rheumatoid arthritis, it's an autoimmune disease. What went wrong in that particular patient that is acting against their own body, right? There might be some like psychological, there might be some other root causes which we need to take care of.
agree with you. Yeah. So here, this is a perfect example showing that how, the same thing that comes to mindfulness, her entire system was not accepting. She was very having negative thoughts in her mind, which actually affected through her nervous system back to her body, where it went all the ways to her knees, right?
Yep.
And
Yep.
so yes, so that is what, and I think that's why you told very perfectly is to lifestyle. That means maintaining calmness, doing meditations, more of meditations, doing light yogas at that age for their seniors, right? At that age, whatever is easy for them, and learning to detach, learn to detach with a couple of things in life. I think that actually helps them to take care
Mm-hmm.
of themselves from within. This is a very big learning because I think most of us, whether it is the seniors or in the early stages of 50s, need to understand that, right?
Mm-hmm.
For us to maintain good health, we need to have a stress leave. I'm not saying nobody's free of stress, but need
Yeah.
to lead a life that becomes stress leave,
Right.
stress.
Right.
So that's a very nice case study part you told, Vandana, is that I would like you to end this session by tell something on your part.
Yeah, yeah. So, like I have seen when I started my practice in US, most of the people come up with like, too many combinations, too many like supplements, unnecessarily they are taking. So, whatever you are putting in your system has to process that. Okay, so if the health practitioner is not prescribing it, don't start anything of your own. That is my like takeaway from this. Most of the time what I have seen in my so don't start anything like blindly saying that certain supplement takes care of like brain health, gut health, or something. Like even the probiotics, don't take it unnecessarily because there are side effects of probiotics as well. It's not. Know yourself first. What is your prakriti, what is your constitution, what suits you, right?
Mhm.
Don't just follow blindly. And like keep yourself moving, keep yourself motivated, practice mindfulness. Like I'm a mindfulness master practitioner as well, so that helps you like gives you a complete different perspective handling the stress,
True.
right?
Yeah,
Because stress is a part and parcel of our lives. We cannot run away from the like how to manage the stress is the key, right?
absolutely. I agree with you. And also, over-the-counter medications has become so normal nowadays. Like, I think
Mm.
all push, like, I need more vitamins.
Mm-hmm.
We all think that we need more vitamins. We need vitamin B, vitamin D, and then your house is full of all the vitamins. So you keep on taking this extra nutrients, thinking that's
Mm-hmm.
going to
Mm-hmm.
help. So
Yep.
that always I keep on thinking about it, Vandana. Does it really help? Because okay, how do you know you have good content of less of vitamins in your body and more of calcium? It's not just your blood report, right? You
Right.
need to think more than that and go beyond that. That's where comes is to, I think,
Mm-hmm.
lifestyle
Mm-hmm.
changes, which makes a huge
Yeah.
difference. And
Yeah.
yeah,
Yeah.
thank you.
I mean, yeah, one way people are using frozen leftover foods, and one way they are dumping the system with the multivitamins. So, does that make sense?
It doesn't. It doesn't actually. But and if you look at it in every senior house, whenever I went to meet them or even have a conversation, they do have their medications, but they also have a lot of over-the-counter
Supplements.
meds.
Right.
They're
Right.
always taking, constantly taking medications with respect to their food. It was equivalent to the eating their food and their medications.
Right. Right.
I think that's what is bringing about even imbalance
Mm-hmm.
in the
Yeah.
entire system.
Mm-hmm.
So
Yeah.
yeah, this is very thought-provoking session. I think this is something which we need all to understand is homeopathy has to do a lot with our yogic culture of telling about even the importance of sattvic ahar. When it comes to our, of course, going through our culture from where we all come from. Why? What is sattvic is, of course, vegetarian diet. Do you want to say something, Vandana, before I know it might take time, just to quickly say a few words why sometimes vegetarian diet also helps a lot with taking care of your body?
So, most of the people don't know the concept of like how good your digestive fire is, right? If you are not able to digest that, like it's just putting a like wet log into that fire, which ultimately gives nothing but the smoke, and that doesn't get digested very well. So, I would say like at least cut down the red meats. Even the fish and the chicken is fine. Even like it doesn't come under the sattvic diet. But yes, go mostly for plant-based diet because that is the easy to digest food. And cook it, steam it or saute it, cook it and then eat it. Make it more digestible for your system.
Yes.
Hmm.
That's one thing because for some people it's so difficult when I tell them about a vegetarian diet, which is important,
Yeah,
they can't because it's like we've been
yeah.
always eating
Hmm.
non-vegetarian. I think that's what you said. So they can
And
eat, but again, there should be a limit of what they're eating, and cutting of red meat is the
yeah,
biggest thing. Like they
yeah.
need to,
And freshly made, home cooked, like all these matters.
yeah.
Mhm.
Definitely. Yeah, I don't think people have any more questions for now, but thank you so much, Vandana. This was very effective talk, and even though we ended the talk about arthritis, also not down the lane, there may be other subjects, which I would like to definitely talk with you and find out, right? Which is
Yeah, sure.
generally asked by elders, because see, I'm getting emails and get texts constantly asking why not this question. And most of the questions they asked is what we discussed, and it runs back to the same thing. It is
Mm-hmm.
about the same medication. Can I take along with other medications, right? That's the big.
Yeah, 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 yeah,
And also
definitely.
give a gist of in a quick gist in your words, Vandana, like if suppose they want to do out of pay and they want to pay and to meet a homeopathic physicians just to go and talk about their health, how much does it generally charge for them, or it is differing with respect to how is their chronic conditions, right?
Yeah. So I have set certain amount for my consultations, but I also go with I keep it open most of the time considering the financial challenges. So payment plans are also available. Discounted prices are there. So if somebody is willing to work with me, just give me a call or we can talk and we can come up with like whatever they are willing to. So pretty much for seniors, I keep discounted prices.
That's perfect, because I know that a lot of people do ask that, sometimes
Yes.
they come only through Medicaid programs through Mass Health, and Mass Health only allows them to certain things, right? Which has to go
Yeah.
to insurance. So if they want to approach you, if they let me know, I will definitely ask them to connect with you.
Yeah. Yeah. Definitely. I'll be happy to help them. Yeah.